There he is.
Oh, hi Dad, how are you?
Ciao. Come va?
Molto bene. And you?
Mi manca il lago di Como.
So it was very nice to have you in Como last time. So you have to come back and join us once again.
Thank you, will do for sure. Parlerò in inglese per questa sessione.
Yes, I think it's better, but we can do it also in Italian if you want.
No, I think we'll be safer with English.
Great. So thank you for inviting me and taking part in this. So
we already have a good number of people joining, and I know some others are going to join. I'm just going to introduce you, Dr. Forte, for those who may not know you, but many do of your reputation. So for those of you with us, Dr. Riccardo Forte is the world expert, world authority on Endolift. He does have some other colleagues who are also very experienced, of course. And I had the honor of training with him in his clinic, and we treated a lot of cases in a full and very fun day in Lake Como. So not only did I get to train with him, but I went to that amazing place with the beautiful scenery. So it really is an honor and a pleasure to have him on board today. And I've already had quite a lot of questions being sent to me in the last week since we advertised that we were going to do this session. So I will try and ask some of those questions and we can have a little discussion. Obviously, Dr. Forte is a trained plastic surgeon. And so it's nice to have a surgeon on board when we're talking about something slightly more non-surgical, because he can offer an opinion from both sides, from the scalpel side and from the non-scalpel side as well. So, Dr. Forte, if I can start by asking you, when you're doing a traditional facelift or neck lift, what are you doing? What are you trying to achieve?
Well, first of all, we have to understand that surgery is improving the excess of tissue, so you remove tissue, and it's fantastic when you have a very severe laxity of muscles and skin. But, when you remove skin, of course, you have to detach the skin from the deep tissues. We have to cut, and of course, the trip along the surgery is something that can be very involving for the patient. So it's very important that the motivation of the patient is really high because, the patient is involved in a very complete way. It takes time to recover after the surgical facelifting. And of course, the results can be brilliant, but the balance between, costs, general cost and benefit should be accepted by the patient. So it's a very personal choice, and you need a strong motivation, apart from the real indication to do the surgery.
So the one big thing which I found with offering non-surgical options is that we don't have the advantage of maybe giving a very quick and immediate result. But the big advantage for me, I feel, is that we are working on many layers and actually improving the health of the tissues. And in this way, we're giving improvement in contour, more like a 3D effect. Would you agree with that?
Yes, of course. The medical, the non-invasive approach, talking about Endolift, we are working on the quality of the tissues. In a surgical facelifting, we are just removing tissue, but we don't affect in any way the quality of the tissue. That is going to be the same as before. Well, the same. We should talk about this because the surgical approach can, in a way, disturb, the health of the skin because of the touching, the reduction of the vascularization of some areas. This might, in a way, accelerate a little bit the aging process. If we look in medium long time. Endolift is not aggressive on the tissue. It's stimulating, it will improve the collagen production. It's not a bidimensional reduction, so we are not shortening the skin. We are just attracting the skin forward the deep tissues. So it's a sort of attraction, you know, that is really remodeling the face. It's not actually reducing the skin. And it is due to the stimulation of new collagen synthesis. So we are improving, we are working, we are interacting with the quality of the skin. So is in a way, is a real rejuvenating treatment.
Yeah. So before we go more into Endolift, for some people who have joined who don't actually know much about it, I'm just going to explain one little bit about it. So for those of you new to it, the idea with Endolift is you can come in, you don't have to have the same prep as if you're having surgery. You can eat a meal. We encourage you to have a meal and then you come in. And the anesthesia is local anesthetic. It's a mix of local anesthetic solution that is very quickly, within 20 minutes or so, infiltrated into the target area. So, for example, it could be the lower face and neck, and you're fully awake. And once that's put in, the treatment is actually quite comfortable, and the wire that's used to introduce this laser, and it's laser technology, is actually as thin as a hair. And what impresses people is when they sit back up from having the procedure, they're always very surprised. They're looking for sign of injury, and really they look pretty okay. Yeah, maybe a bit pink, which is just because of the heat, but they look fine, and they feel numb, but otherwise they feel fine as well. And even afterwards, patients don't really need painkillers. Would you agree with that, Dr. Forte?
Yes, I mean, what is impressive that is, if we compare the quality of the result and the engagement of the patient, I mean, the way the patient is involved in the treatment, this is amazing, because they really have a very comfortable procedure. They go immediately back to daily life, with any discomfort. The result is effective and stable a long time. This is actually uncommon for medical procedures, for not invasive procedure. We have results. You have seen my follow-up, and I still can have a photograph, obvious result after 5 years. So this is amazing, actually. And regarding the sculpting of the fat, reduction of the fat. The reduction of the fat is not reversible. So what you obtain in the fat reduction is stable along years. So the fat won't come back. So we just have to maintain a long time the tightening of the skin. But if you have double chin, you have a neck with fat, you reduce it, so the reduction is stable a long time. So it's permanent. I mean, this is amazing for a non-invasive result, for a non-invasive procedure. And the most interesting thing is that the microfiber that is directly in contact with the target, because we go below the skin, and we interact with the septum and the fat. And we need a very small amount of energy because we are very close to the target. This is actually the best principle of this procedure. And this is amazing, because with very low energy, you can have a very effective effect. So as you said, just take 30 minutes and, the game is done. It's amazing.
So how do we differentiate between when we just want to target skin? So something people will often ask is, in some areas, for example, here, where you want to get some fat reduction, but also tighten skin. But in some other areas, you don't want to target the fat. You just want to get some skin rejuvenation. So how do we avoid affecting fat where we don't want to?
I mean, this question is very interesting because we need to be selective either on skin or skin and fat, because in a very thin phase we have to conserve the fat. You know, this is mandatory. So it's very easy actually when you understand the action of the laser. This wavelength, this particular wavelength that is 14, 17 nanometers, is extremely affecting on water first. And it is also affecting on fat, but a little bit less. So very small amounts of energy will be already effective on skin tightening, but you need to increase a little bit the energy and the pulse of the laser. You have to enlarge the pulse of the laser in order to involve the effect in the treatment. So low energies, short pulse will be affecting your skin, and longer pulse with the higher energy will be effective also on fat. So you can select and you can decide which areas you want to reduce fat and which areas you want to do both. Only skin tightening or both skin tightening and fat reduction.
Yeah. Okay. Thank you. I had a lady, a fairly young lady, come 6 weeks ago, and she had. She's a new patient. She had fat dissolving injections somewhere else. She was happy, but she said the swelling was very significant for a few weeks, but the result was good. So she wanted me to do the same. I don't actually offer fat dissolving injection in my clinic. So I said, I can send you somewhere, or I can offer you just a mini Endolift. And so she agreed, and I said, please be patient. This is, a slow rebuilding process, 1 month, 2 months, 3 months, 4 months. And she came after 3 weeks for another reason. And she said, even if this is the final result, I'm still very happy. So she was happy very early. And then she came today, another 2 weeks later, and she said, it's even better. And of course, this is what's happening, isn't it, with this treatment? You're gradually getting more and more improvement. So the fat is, are you liquefying the fat?
Well, you have 3 actions on the fat. You are liquefying due to the heating process, to the energy. You mechanically destroy the adipocytes because of the fiber running in the soft tissue. And you will have, after 30, 40 days, an apoptosis. That means that the cells that have been anyway disturbed by the heating process will program their own lysis, their own death, so they will disappear in 40 days. So these 3 are the mechanism through you obtain the fat reduction.
Yeah.
And as you said, the result will improve until 6 months. Even if, most of the result you will see in 3 months, but after 4, 5, 6 months, you still see a little improvements, especially when it comes to the skin quality.
Yeah, and actually I did a few 6-week reviews just last week, and every patient, the skin quality already after 6 weeks was amazing. That was very apparent. I always explain to patients and anyone who's a potential patient for any collagen stimulating treatment, particularly things like this, you have to bear in mind that a photograph, we'll all have nice improvements on many patients on photograph, but remember, a photograph does not give you a full accurate reflection of the 3D improvement.
True.
And, if I suddenly increase my collagen now by 15%, what do I expect to see in a photograph? And what I say to patients is, if you want to get a better idea, then pinch your skin. And many patients will say they feel the improvement before they maybe see the improvement. The other thing is the psychology is, you have to remember, when you're at home, you're seeing your face every day. So today, when I look at my face in the mirror, I'm comparing it to when I looked at my face yesterday in the mirror. And we look in the mirror 3, 4, 5, 6 times a day. So every time we're resetting our memory. So it's very hard. Whereas when I see a patient come in the door after 2 months, 3 months, they take the mask off and instantly you can see that they look better. Maybe on the photograph you can see, you can't see, but you can just tell the skin is just a better quality. Would you agree?
I mean, yes, it's exactly what happens when my patient comes back for the control after 1 or 2 months. They say, I see it, but what I like most is that I feel it. They feel it. So they feel the tightening. They feel that the firmness of the skin has improved. So when we took pictures after 2 months, they say, listen, doctor, it doesn't really matter, if I see the photo, because I can feel it. When I touch myself, I feel a different face. And they look at the result in the photos and they say, yes, I see it, but believe me, I see it more in my mirror at home. I see it more when I'm in the car and I look in the mirror and I can see that my face has been, remodeled in a very complete way, So the 3D effect, the dynamic effect, is more involving the patient, more satisfying the patient than the pictures, than the photos. It's absolutely true what you said.
So, Dr. Forte, let me ask you, after this and this area, if we're looking at the rest of the face, many people are not happy with this area. Sometimes plastic surgeons send people with malar bags to me. What are your thoughts on treating these areas and how successful is the result? Well,
when you approach a patient, if they come for this area, you know that you have in your hands the best non-invasive procedure you can offer to your patients. So, this result can really, give you a big satisfaction. And 100% of cases, you see the difference, 100%. Sometimes it is a brilliant difference. It is an excellent difference. Sometimes it's a good difference, but maybe not excellent, but very good or good. But it never happens that you don't see anything. If you are applying the correct procedure. Because I want to say something. Endolift is a fantastic treatment. It's dramatically operator dependent. And it's extremely important that the doctors are trained by good trainers, because the technique and the way you use Endolift is absolutely extremely important to achieve the results. So first of all, you have to be sure that you are with a doctor, with an operator that knows the technique. Second,
I always go with the best. I always go to the very best person. You know that, right?
But it was a pleasure, to have you and join and share my experience with you, because I could feel that you have good hands. You caught immediately the principles and the details. So and we did it together. So I saw that you are a fantastic operator with Endolift. But it's, as you know, how you could really touch with your hands. It's a dramatic difference if you apply the correct technique or you're not. So this is why we are investing a lot of time, energies, and also money to offer with Medi Oracle, with Marco Bottone. He is the one who put us in contact. So we are working very hard to be able to offer a training. We found the Academy in order to offer the perfect training to all the operators. So this is extremely important. So going back to the question, when you treat this area with the proper technique, 100% of cases you see something. but maybe sometimes you feel like you can do more, and maybe you plan to do a second treatment in 6-8 months. So this might happen, but anyway, you're gonna see something. There are some other indications, like the malar bugs, as you said. In this case, Endolift can be a very good procedure, but not always the result is under the control of the operator. So this is a good chance. This is, a possible treatment that you can offer to the patient, but the individual response is extremely important. So I don't know if you agree with me. Approaching this area, you have to be a little bit more careful in creating too much expectations. So it's a good treatment, but anyway, there is, variability in the response for each person. And this is the same, for example, for those indications like, the lifting of the eyebrow or lifting of the mid-face. These are areas that might react in a positive way, but the result that you see in these areas is absolutely a bad one.
Yeah.
If you agree with me. So,
yeah, no, absolutely. And I think we do have to be much more careful here. And the amount of overall energy, even with other technologies that I've used, AccuTite, FaceTite, etc., the same thing applies. You have to do a fraction of what you can do here.
Yeah.
And you have to be very cautious. What about the body, which I know we can use it in many, as you know, I did a knee case just a couple of weeks ago, but which body areas do you find are the best, are your favorite to treat with Endolift?
Well, Endolift works in a fantastic way on soft fat tissue. So inner thighs, abdomen, also probably the inner knee, but the inner thighs and abdomen, I think, are the two most responsive areas when it comes to fat reduction. Is a little bit harder when you approach areas with cellulite, especially if it is a fibrotic cellulite that has been treated before with other treatments. So when you reduce the component of the fat and the fibrosis is more relevant, then it becomes a little bit harder with Endolift. So fantastic also for the tightening of the inner thighs. This is an area where you don't have so many other options. So Endolift becomes extremely important, but there is no a real alternative. Also with surgery, very, we have to pay a lot of attention when you approach the inner thighs, because it's an area that can give you irregularities very easily with classical liposuction. This is a very delicate area that I love to approach with Endolift. Ankles is also a very difficult area that can be treated with Endolift. You have to plan multiple sessions for this area and approach it in a very gentle way in order to avoid the edema that might last for quite a long time in this area. Arms can be treated with a good success. Also depends from how much skin you have to contract, you have to reduce, and how much fat do you have. Stomach, as I said, is a very sensitive area for Endolift. You can have very good reduction. Sometimes you can compare it to very little liposuction. So it really can be in some situations a good alternative to surgery.
Yeah. Okay. And so going back to the lower face and neck, at what point do you? I know when we treated a couple of cases at your clinic, where you maybe advised the patient that, look, you would benefit from maybe one more Endolift in 5 or 6 months. But at what point do you say, I think surgery is better for you?
Well, for example, when you have to reduce muscular ptosis, that because the Endolift is effective on skin reduction and fat reduction, but not on muscles. So Endolift is able to contract the skin and put the skin very close to the muscle. But if the muscle is hanging, then of course you can't go over, you know. So when the indication is replacement of the muscles, then it might become a surgical indication. But also in those situations where you don't have a real indication for Endolift and you enter into a surgical indication, you might treat the patient anyway and advise the patient that she might have a partial result. But sometimes it can be also satisfactory because the patient prefers to undergo to a treatment that is not invasive and maybe doing it twice or 3 times instead of going into surgery. So, I mean, it's a personal choice for the patient, and anyway, with Endolift, you can offer, you know, a good option, even if it's a surgical indication.
So I just wanted to say for those who are watching, if you do wish to ask any questions live, you can type them in, and we'll look out for them. See, I think there was something in Italian that Simona asked. I think she's maybe asking to make an appointment with you, but but we can look at the end. But if you have any specific technical questions, you can ask. Something I love about Endolift is that, which some of you may have missed because you've been joining at different times, is that the overall risk is very small. You know, nothing is risk-free, but it is, I would say, a very safe treatment. Particularly if we're working in this area, we have to be a bit cautious. Sometimes if we overcook this area, it can have a temporary effect on a nerve there. But still, really, it's very safe. And patients really, afterwards, there's a little bit of swelling, there may be a bruise, but as Dr. Forte said earlier, you can go back to normal day-to-day life pretty quickly. Maybe, you know, exercise, strenuous job, something like that, you might want to hold off for a few days. And that's what's really amazing about this is, and generally, Dr. Forte, we don't advise for this thing that they need to wear any supportive garment, maybe just for the day.
I mean, it's something that is not mandatory. I mean, it might help to wear something that give you a little bit of compression, might help you just to reduce a little bit the edema, so you can wear it for 2 hours or maybe 24 hours if you are comfortable with it, but it's not mandatory. A lot of good operators, they don't advise anything after. It might help, for example, to do some drainage, manual drainage, you know, lymph drainage after the treatment, in order to remove the mild edema that might occur, just to reduce it faster, quicker. But I mean, it's just something that you know, might improve the compliance of the patient, might improve the comfort of the patient, but it doesn't really affect the result. So I mean, you can do it and just forget it and go back to normal life. And also, social life is not disturbed anyway. It's not affected, and this is something that I mean, it's the real mini lifting of the lunch break, you know, as we say. So you just do it, and you go back to work. You go back to, you know, you go out for the aperitif or for dinner, and nobody can see it. And maybe. I sound boring a little bit repeating it, but it's extremely important that the correct technique is applied. I have a lot of complainings by patients that has been treated not in a proper way, that they didn't see results, that they had annoying feelings, the skin or the subcutaneous was painful for days or weeks. I mean, this is due to an improper treatment. So it's extremely important that patients go to doctors that know the procedure, that has been trained the correct way, that, you know, that can offer the correct support to the patient. So this is extremely important. It's not enough to have the machine. I mean, you have to know how to play with the machine.
Yeah, absolutely. As with anything, that you can do just as much harm as good with a lot of this technology. So it is important to have that thorough training. We've just got a question here. Going back to technical factors for the mid-lower face, can you summarize the key aspects in your experience, tissue depth, etc.? So, so I think for what you're asking, so really we're working subdermally. We are working very superficially, really, with this laser. There's two different types of, for the doctors amongst you, there are two different types of wire to introduce the laser. There's the radial, which is 360-degree laser delivery, and then there's the it's called the linear, isn't it, where it's
and the linear, the linear is
yeah.
36, 37 degrees.
Yeah.
There are different beliefs about that. So I personally prefer a little bit the linear one, but some operators prefer the radial one. And this is really personal. It really depends from, the sensitiveness of your hands. Anyway, as you said, we work in the subcutaneous layer very close to the dermis. Also, the fat is treated starting from the surface and going deeper while you are, melting the fat. So actually, the action is always very superficial in the subcutaneous. This because the nerves and the vessels are running deeper, so we want to avoid to involve nerves in this treatment, and because we want to stimulate the dermis. So we don't go so far, we never go far from the dermis because we want to stimulate it, because we want to renovate the architecture of the dermis in order to obtain the rejuvenating effect. So anyway, it's not a very deep treatment. We are working superficially, and the way you move the fiber just underneath the skin is very important. You can be fast, you can be slow, you can stop and do some local, how we call it, stocking stimulation, and the way you manage with this parameter, it's very important because it might change the difference, it might change the result, so that's why it's important to have a little bit of experience in order to understand how any tissue is meant to be treated.
Yeah, absolutely. And so we've got another question. How long does it take before improvement is seen in the malar bag area? Before you answer that, Dr. Forte, I just want to make a general point that you, when patients sit up after the treatment, they can often see an immediate improvement, but that is partly because of the heat effect and the immediate mechanical contraction. And I always say to them, don't get too excited. This shows you that we have done a good job. It's done something. Energy has gone in. You can see that. But when they wake up in the morning, they're not going to see that same result. And then really, you're talking about a few weeks down the line, maybe 4 weeks, where you can start appreciating the gradual improvement and recontouring and improvement of the skin, etc. And then month on month, it will improve. So maybe, 70%, 80% might be seeing it in the first 4 to 6 weeks, and then others will gradually see the improvements. Remember, what you see is down to your perception, and perception is not reality, but it's your reality. So you have to sometimes understand that. With the malar bag area, I don't know if you heard Dr. Forte earlier mentioning that we have to, although these areas can respond well, they're considered like secondary areas because we have to be a bit more cautious about the technique, the energy that we deliver here. But again, a similar timeline would follow. Would you agree in terms of when someone can expect improvement in the malar bags?
Well, I mean, it's very variable from one patient to another one. Sometimes with the malar bag, I see an improvement after 2-3 weeks, and sometimes they have to wait 3-4 months. It really depends. It's an area that can respond extremely quickly. Sometimes after 2 weeks, actually, you see the contraction. So it's it's very difficult to predict, you know, the answer of that area.
What I always say to people is have low expectation, and then like that lady who came 3 weeks later recently, then if you're not expecting it, you're even happier. Yeah. Someone's asked if you've had previous surgery, can you still have this treatment? So if you have had a previous facelift, for example, can you have Endolift in the same area?
Yes, of course. But in my experience, patients that have done a surgical facelifting might respond a little bit less. This is due to the fact that with the facelifting, we are losing the connections between the fascia and the skin, so we don't have the septum that are contracted by the Endolift. So we can have a good result in fat, we can have a good result in the skin quality, but sometimes the contraction might be not so relevant in patients that had the facelifting, especially in the area that has been detached by the facelifting. So, for example, this area, if the facelifting didn't involve the complete neck neck lifting, so in this area you might improve the result of the facelifting because maybe, for example, there is a little bit of fat left after the surgical, the facelifting. So it really depends from the different situations, but what is important to understand that in some areas we lose the subcutaneous septums. So, I mean, there's no the target for Endolift.
Okay. So someone has asked about the products my Aftercare protocol and the product I recommend. So as we were talking about earlier, it's not mandatory, but I put a little hyaluronic acid cooling sling onto my patient, which sits on them hopefully for a few hours, maybe the rest of the day, then they can take it off. And before I put that on, I cool them, and we put a Selderma GF5 a growth factor serum on. That there isn't much healing that's required, but what I'm doing with the growth factors is we're causing like a micro injury really, and we're trying to trigger the body's regenerative process. The other processes Dr. Forte has already mentioned regarding what we're doing with the fat, but with the skin, we're really calling on the body's regenerative process. The problem is from our late teens, we're not really making many growth factors. So by giving this topical high dose growth factor on top, it just will help potentiate the results of the skin rejuvenation. So again, none of this is compulsory, but generally for any of these treatments, we prescribe this Selderma product or something similar if you don't have access to it, which will just help with the whole process of regeneration. And that's, I think, where this is going, isn't it, Dr. Forte, is that more and more we're moving from the surgical approach to actually saying, let us try and get this regenerative process started so we can have multi-layer holistic improvement of the skin health and the tissue health. And yes, it's more gradual, but overall, I think our patients will look more natural and they'll look overall healthier, I think, as a result.
Yeah. I mean, in the medical approach, when we want to improve the quality of the tissues, is always with any procedure important the way you prepare the patient and the way you follow the patient after the main treatment. So, as you said, if we want to improve some regenerating processes into the skin, if you prepare the skin with growth factors, or for example with retinoids, are very effective in activating the fibroblast, activating the new angiogenesis, activating collagen and hyaluronic acid production. So retinoids, growth factors, injectables that might improve the metabolism of the skin. Anyway, Endolift is stimulating some processes, some metabolisms. And if you support these processes with nutritional supplements, local, systemic, oral tablets, I mean, anything might help and support the main treatment. also you can combine it with different treatments. For example, sometimes when I have the laxity of the platysma, I prepare the patient with a little bit of botulinum toxin in the platysma bands in order to reduce the tension of the muscle and, make easier the contraction of the skin, because it doesn't have the opposite strength of the muscle. This is something that can be very effective, for example. Or the combination with Endolift with focused ultrasounds in order to improve the muscle replacement and the skin contraction. So, synergies are always welcome in medical approach, but also in surgical. But in medical, where our weapon can be a little bit weaker sometimes, it's better to create synergies that can improve the power of our strategies.
Yeah, absolutely. So there's quite a lot of questions. So I'm just going to very quickly go through a few. I have a couple of patients. So it's okay to have some numbness. Obviously, the anesthetic will leave you numb, but for a few weeks after, it's okay if the skin doesn't feel quite normal. Would you agree?
Absolutely normal. So the patient has to be informed that the numbness is part of the game. So it is normal. It's not a side effect, because the stimulation, the thermal stimulation of the skin causes this kind of effect that is part of the game. And until they feel the numbness, that it means that everything is working. So it's really a good sign that we have been working properly on the skin.
Someone has asked one of the doctors, is it essential to cool the skin after the procedure?
Well, it's not for the pain, but it's only to reduce the risk of increasing too much the temperature. So, I have done hundreds of treatments without the cooling system, and I've done hundreds of procedures with the cooling system, and the result is the same. But, having a tool to control the excess of the temperature might improve the safety profile of the procedure. Especially when you're not, so expert, and you might miss a little bit of sensitiveness in your fingers to control what you are doing. So, it is something that can give you a little bit of insurance, of controlling the temperature.
So, this must be someone in the UK has, so I'll answer this. If you need CQC registration, I have to say, I'm not sure. I know you do for face sites. And I don't know if you do for Endolift, and I should, but I have got CQC registration. But if you DM me and just remind me, I will check this out and then let you know. You've also asked, is it possible to have training before you purchase? So, yes, so obviously any kit is a big investment. What I would do is, if you're in the UK, which it sounds like you are, contact Marco at Europhoton, and he can basically inform you of what opportunities there might be for you to go to a workshop or get training before you make that final commitment. But he'd be the best person to do that.
Yeah, Marco is working a lot on this, because it really cares about the proper development of the technique on the territory. Because, as I said before, when the operators are not applying the procedure in the correct way, this is not good for the image for the procedure. So, the distributor Marco Bottoni is working a lot, and I'm joining him in this process. So anybody can refer to Marco in order to obtain the best training course, and this is not recommended. I think it's mandatory.
Yeah, no, absolutely. And if you happen to go to Lake Como, just to let you know, you can get lovely clothes like this from there. this wasn't, I didn't purposely put this on. I just realized when I started.
Great. Italian fashion. Yeah.
My New Year's Eve, I don't know if you do this in Italy, but on January the 1st, people make like the New Year's resolution for, to what they're going to try and achieve for the year. So mine is to make my entire wardrobe Italian by the end of 2022. So that's my goal.
But Dev, I mean, now I know you have performed a lot of procedures and you're becoming more expert and than you were before. So it would be interesting now again to to compare the technique you developed with mine again, and I'm sure we can both enrich our experience by exchanging our experience. So really, I will be very pleased to work with you for one day like we did last time, and and share our experiences again.
Yeah, no, definitely. I'm gonna make sure I arrange a day this year, and then we're gonna.
It might be in England next time, not in Como.
Yeah, absolutely. And then we have to first. I have to come onto your boat. Yeah. And we have to go on the boat, and then and then also.
I wait for you in Sanremo.
Dr. Forte checked out my past and saw the naval history, so he was he's mentioned his boat to me, and I must. It sounds a lot more glamorous going on the lake there in his boat than it does here in the Solent. But anyway, so any other questions anyone wants to ask me before we wind down? So really, for those of you who kind of joined late on, I'm based in the UK in Portsmouth at Perfect Skin Solutions, and we've been doing various energy-based facial and body contouring treatments for many years. And I kind of, Endolift came to the UK in 2019, and it was relatively new. I was doing FaceTite and Accutite and other things at the time, which is great technology and very well accepted around the world. And I don't think, with any of these things, we all have, I still have both at my clinic. What I do really much enjoy with the Endolift is the ease. It's actually easier for me as a practitioner when I'm doing the procedure, easier on my limbs. And I love the fact that the entry points are actually invisible after you take the laser wire. You can't see where you've been. So in terms of external indication of anything being done, other than a little bit of redness, a bit of mild swelling, and possibly a bruise, there really isn't much indication to the outside world that anything's happened. But inside, a lot is going on. And that's what's quite incredible. Typically, traditionally, you either accept low downtime, but then you have to have many, many, many sessions of a treatment to get small improvements, or you accept a very aggressive, very powerful treatment with a lot of recovery and a lot of downtime, but then you get good results. Whereas with this technique, it seems to have the best of both worlds. Yeah. And I think for me, that's the real magic with Endolift.
Yeah, and you will be even more surprised when you will take pictures of your patient after 2 years. And then when they come back and they say, doctor, I don't see the result anymore, and I think it's time to do it again. And you will take pictures, and you will have the surprise that you still see the difference after 2, 3, 4 years. And there's no other treatment, medical treatment, that can allow you to achieve this kind of stable result a long time. It's amazing. 4 years, 5 years. And I can tell you 5 years because I started 5 years ago. It might be even longer.
Yeah. And Dr. Forte in his clinic has got this vase where he collects all the laser tips. And it's a nice little art piece now. In fact, Michael, I'm still waiting for the vase that you promised me. But what's amazing is he's done so many. I don't know how many hundreds or thousands you've done of the. I've
done. In my clinic, me and the doctor that is working with me, that is Domenico Romano, we performed about 1,500 procedures in 5 years.
Yeah. So you've got good data, good numbers, which is what is good. And in fact, you told me that you developed your own protocols over time, like we all have with other treatments. Especially when you're the pioneering doctor, you have to discover your own protocols and what works best for you.
Yeah, I started with the guidelines that the company gave me, and they were good guidelines, and I started with very good results. But as you said, I mean, when you get in contact with the procedure, you can personalize it. And at the moment, I have much better results. And I changed quite a lot the parameters and the way I was, running the procedure. And for example, I was the first to introduce the local anesthesia in this treatment. That is not mandatory, but in many situations can make the difference, regarding the comfort of the patient. So the way I was taught about using the machine, it was without local anesthesia. And there are a lot of doctors that are still doing the procedure without local anesthesia, and you can do it. But of course, the fluence of energy has to be lower, and when it comes to fat, with lower energies, it might be difficult to obtain a very good fat reduction. So, I mean, I personalize my own protocols with the local anesthesia, and especially for the fat dissolving. I mean, I find it more effective with the local anesthesia. So, I mean, then it's up to the doctor to decide to do it or not. But as we shared before, with the local anesthesia, a lot of things might be much easier.
Yeah, I don't like seeing my patients in pain.
Yeah.
and so yeah, I'll always do it with that. And it then they can relax, and the whole experience is good. You
know what is nice with Endolift? That you do the procedure and you sleep at night.
Yeah.
If you compare it with other procedures, then you do it, and then you very often cross your fingers and you hope everything goes fine.
Yeah.
With Endolift, you sleep tight at night.
That's absolutely true. I did one today, and you're right. I'm relaxed.
Yeah. You just expect the patient to come back and just say how happy she is.
Yeah.
And it's amazing when you treat half the face and you give the mirror to the patient. That is the moment when they see the best result, because they see the non-treated area that is completely different from the other one. We experienced that together. Do you remember in Como? We were just looking, tight neck, tight jawline, and on the other side, everything was lying down. So, I mean, this is amazing.
Yeah, and actually, when you do the treatment, the feeling of the treated side is so different.
The elastic response of the tissue dramatically changed from one side to the other one when you have tried to treat after face. So, and this is something that you can show to your patient. The patient can touch and feel during the treatment that the parameters of the skin are changing.
Yeah. So, Dr. Forte, we've almost approached an hour. I think we've covered a huge range of questions. I think I've answered pretty much everything that was asked. If I have forgotten any questions, I beg you, please do message me or Dr. Forte, and we will send you a quick answer without any problem. So I hope you've all enjoyed today. Dr. Forte, did you want to say anything that we haven't covered that you feel you want to?
Well, to doctors, I would like to say that doctors are always welcome to come and see the procedure, and we offer any kind of support to the owners of Endolift and to all the doctors that want to improve their own skills using Endolift. So, I mean, we have to become a very tight community where all of us can, share, exchange their own experience in order to make this procedure grow even more and make it even more, effective than it is. To the patient, I can say that this treatment changed my daily routine in a dramatic way, like the botulinum toxin did 20 years ago. So imagine treating this area, the wrinkles of this area, without botulinum toxin today. And it's the same for me for this area with Endolift. So it has been the procedure that really made the difference.
Well, we'll end there. And thank you very much for joining us. I know it's 1 hour later for you in Italia, so thank you very much. It's an honor and privilege to have shared this hour with you. And I look forward to my next trip to see you and also welcoming you to England. And thanks to everyone who has joined us today for this session on Endolift. And hopefully we'll do another one maybe later in the year. And you can join us then as well. So thanks and good night to you all.
Good night to everybody. Thank you, Dev, for inviting me. I really enjoyed it and hope to see you soon. Bye, everybody. Bye-bye.
Bye. Arrivederci.
Buonanotte.
Ciao.
Ciao.